Hey, Andrew, very good morning from London. Very excited to connect like this once again. It's been an incredible time for those of us covering these events, but especially to contrast what's happening between Asia and Europe, between emerging Europe. The successes that Asia has had, many of us are envious of, but we're looking for ways now so that we can collaborate with each other. So, Andrew, am I ready to take it away?
Yes, go for it.
All right. Well,
Thank you.
I would like to start right away by getting to the guests that we've had and start to talk about some of the questions that we've already been receiving, but also to open it up to you, our audience. At any point today, you can send your questions and I'll be answering them and having our panel answer them. I want to start by introducing everybody right now. We'll go through and start with Balazs Fouriers from InnoStars. He's the Director, EIT Health InnoStars. We also have Ji-Suk Chon, a professor from the Helm University Medical School, and Ethan Tu, the founder of AI Labs. And lastly, Tamas Bekasi, RIS Business Creation Manager at EIT Health InnoStars. So I just want to let you guys know exactly what the format is here. Feel free to interrupt each other. Let's keep it just like a conversation would be in real life. No need for all the pleasantries. I want to start by asking, what are the biggest health takeaways thus far? I mean, it's been a very interesting time. There's lots of we've learned, you could say somewhat obvious about telemedicine, but I'm interested in terms of big data, in terms of AI. What are some of the biggest takeaways? Tamas, I want to start with you.
Hi, everyone. Nice to be here. Whenever we are talking about telemedicine or AI or any type of big data-driven solutions, these are not new. So whenever we are talking about, and it's really hard to tell something positive about COVID, but if we want, of course, we can highlight the fact that healthcare innovation and healthcare itself became a more popular topic within the societies than ever. So that's a little bit triggering how not just the society, but also healthcare institutes are reacting for new healthcare innovation. Because right now, of course, continent by continent, it's a little bit different, but we are living in an era where we have tons of actually innovations also coming from healthcare. But on the other side, institutes just partially utilize these kind of innovations. And this kind of fluctuation from the creation of innovation and using the innovation is a little bit more highlighted in this kind of COVID era. So personally, and also EIT Health, we are expecting a new golden era for healthcare innovation from now on. But of course, which is always appearing as a risk in every type of golden eras. Also from the investment point of view, we need to be careful with the too much optimism. So we need to highly evaluate all the kind of healthcare innovation projects in order to reserve this kind of golden era for a long time, because definitely we need it.
Can you give me a little specifics about what you mean too much optimism? Is there a specific area?
Yeah,
I mean,
sure.
Here in the UK, I can say, even though it was very successful in Asia, contact tracing just really didn't work, nor did it work in the United States. So that's one obvious one to me. Tamas, something less obvious? Can you drill down on that a bit for me?
Yes. So just as a general background, so of course Europe, compared to Asia or compared to the US, from investment point of view, I mean the volumes and also from the time to market perspective, it's still a little bit slow. But if we are just thinking back, so we all remember the Theranos story coming from the US, how the optimism or any type of reliability towards biotech products actually drill down because of the fact we all know. So actually, it made a fallback from the investment intention, because of course in many cases investor became less optimistic or less kind of trustful towards these kind of projects. And now because of COVID and now because of the healthcare innovation golden era, investors, after just a short period of time when they become a little bit more conservative, they start to open wide towards these kind of projects. And whenever I'm saying too much optimism, it's meaning that now investors see a big potential in healthcare innovation, and sometimes they don't have the background to evaluate or measure these kind of projects on a professional level. Therefore, they're investing a lot, And if they found these kind of investments kind of fail at the end, then it can make another fallback, like we sensed in case of Theranos. So we need to be careful. Also, investors should, in my view, should involve professional institutes in the measurements and evaluation of these kind of projects. And of course, we much more than enjoy to have more investments within Europe for healthcare innovation, because at the end of the day, this can really accelerate these projects to the market. So we need to be careful with our optimism, but the good news is that we can sense optimism from the investor side.
That puts it into context. Thank you for that, Tomas. Ivan, I want to welcome you to the conversation. I'm interested, what are some of your key takeaways about the future of medicine now and the future of technology in medicine in the context of the pandemic?
Thank you so much. Good morning from Belgrade first. And I would like to say that the vaccines are the solution, but they're not enough. And we have discovered that. So there are plenty of time and efforts that have been done before the vaccines appeared. And I would like to stress on the community and everything and the involvement of everyone from the community. I can talk about our own example from Serbia and Health Tech Lab ecosystem, where all the engineers, designers, doctors were involved in producing solutions in order to save lives until the actual vaccine arrived. In terms of multiple hardware and software solutions, in terms of
tell us about some of them. I'm interested to hear. You can go into some detail right away.
Definitely, yeah. So there were multiple respirators that were actually hands-on produced in Serbian ecosystem. There were several instruments that were actually clearing up the air in hospital areas and then in homes. And there were several actually solutions, apps that were actually detecting or calculating people that were, let's say, more than 10 gathered in certain place. So actually the transmission would be avoided and so on. And we're very, very proud about all of the solutions. Innovation Fund also funded around 12 different solutions that were actually implemented during the quarantine and so on. So we are actually very happy to see that there is actually this kind of empathy and where people even from different kind of technologies that were not focused on health tech were in that time refocusing on health tech and actually assisting in these moments. So this is also another takeaway that besides the community, the empathy and inclusion, it's really crucial. And I think we've showed good results in our own community, and I would say also worldwide.
And of course, while so much of the media attention has been on places like the UK, like the US, which have advanced so quickly with the vaccine, there are so many countries where the vaccine is really a 2022 at best story. I want to go now to Ji-Suk Chon. You're the professor joining us now on stage. And I want to get your sense of what some of the biggest takeaways are over a year into this pandemic.
Thank you very much. It is a pleasure to meet the other panelists. In the beginning, Korea was successful in its quarantine, and the biggest factor was in 2015, we experienced a similar disease, a pandemic, and we made preparations in 2015. There was the MERS, the Middle Eastern Respiratory Syndrome. A MERS, a patient came to Korea and a couple of people died. This led to a shutdown of hospitals, and also our society almost came to a halt, and the economic loss was 12 trillion Korean won. And after that experience, we made thorough preparations, and I am a pulmonologist, and I also worked as the Korean CDC, and at the time we worked on tracing. what we were not good at and in tackling MERS was because of the Personal Information Act, and because of MERS, for a couple of months, the economy and society almost came to a stop. And so we realized that a national economy is more important than personal information, and that was a consensus that was brought about due to the MERS experience. And so when a disease spreads, we were able to trace contact more easily. And when I was at KCDC per year, and that was when there was MERS, and the patient came into Korea, and we would have to identify the patient, and we did a tracing of the contacts, and if necessary, treatment was done. And KCDC at the time earned some knowledge, and it was when you go to the patients, you have to trace the contact. In some cases, they do not tell the truth. And so when asked about who they met and where they went, you use their credit card information for the tracing. And almost all Koreans have mobile phones, and so we can use a GPS system to trace their mobile phone location, where they moved based on their mobile phone location. And many Koreans also have transportation cards, and we can use the transportation cards to trace where they went. And CCTV surveillance cameras could be used, and we had experience for a couple of years due to MERS, and so we were well prepared. And so that is the beginning of our efforts.
Well, I want to use that as a bouncing off point for the next question. Ethan, I'll be interested to get your perspective, but I just want to pick up and ask the professor another question. Was that information gathered with people's permission, or was it government powers that allowed you to collect that information?
I think in Taiwan, because we have experience from SARS in 2003, so I think at very, very beginning, very early, like January last year, so in Taiwan, we have a CECC. It's like a command center to control all the information from the execution unit. That's the top level of execution in Taiwan. But is
it with people's permission, or is this type of data the government has access to anyway?
So we have a type of we have some type of data government already access, like the national health insurance data, including your medical history and your if you come from a foreign country, you also register in that medical record. So in Taiwan, we have a authority that in execution unit can connect all the information in order to trace the contact history. But at the same time in Taiwan, because we are Taiwan AI Lab, we also develop a decentralized approach in order to, for everyone, they keep tracing their own contact history, but store in their own device, which means that if there's confirmed cases happen, then we can leverage the decentralized way to broadcast the device have ever been caused to them. So we developed a context social distance app last April and have a beta release at that time. And it became the open source technique for the government that deploy to all the institutes in Taiwan. They can leverage this open source content history infrastructure in order to trace the content history. So it's similar to like now we can see Apple and Google, they have the infrastructure leverage the Bluetooth device to trace the content. But in Taiwan, we developed this app in last February, then we deploy it in April. So we do it at the very beginning. And also in the NHI, National Health Insurance Agency, we deployed the system. We call this COVID-19 chest X-ray classifier. So in Taiwan, because all the hospitals, they file the insurance claim for the chest X-ray, it will file the medical image to the NHI, National Health Insurance. And then we put a AI classifier in this health insurance agency. So all the chest X-ray is not filed to the National Health Insurance Agency. It will run through this AI algorithm. Then if in this algorithm we detect there's a COVID-19 possibility, it will notify the CDC in Taiwan to trace this record. So through last January to last March, out of 109 confirmed cases, we actually can detect the COVID-19 before the PCR test, because at that time the PCR test was not available at any locations. Yeah.
Tomas, I'm interested. You're listening to what the professor and what Ethan just said, and Ivan, I'll be posing this to you next. But Tomas, to start with you, we're hearing what our Asian colleagues are saying. The centralized system, certainly we have a lot of that here in Europe, including in emerging Europe, certainly more than the United States, where I come from, where it's completely decentralized. So chest x-rays that Ethan is talking about, for instance, I don't think that certainly before a pandemic would somebody be tracking them. Are these models that we see in Asia that our colleagues are talking about here, are they really applicable in places like the emerging European countries? When you talk about big data, I think certainly there's a bigger drive toward privacy here than there is in the Asian countries. So how much can we really take from what they're saying and apply it here, given the different social norms and different government norms that we see between our two regions?
Yes, it's really the matter of price-value ratio. So definitely this kind of centralized. So of course it has many benefits, but fortunately or unfortunately, it's up to how we see it. From the European culture, and the societies are not really capable to be part of this kind of centralized system. Of course, step by step we can achieve it, but that's important that we should draw somewhere the line, because definitely whenever we are talking about the reaction on pandemic, this kind of centralized operation, it's really helping. So that's a huge help. But in other cases, because we all know that implementing this kind of system is not just about taking care of the emergency, because if you're just talking about this, definitely it's a huge benefit. So it's a big question, that how can we make a balance between a centralized and, let's say, emergency focused system, because definitely personally I would really encourage this kind of implementation in Europe, or also in the US. But I truly believe that between the two kind of setup, there is a middle way, and it's starting with the harmonization and synchronization of the accessibility of data. So whenever we are talking about Europe and the European reaction on any type of emergencies like the pandemic, and also whenever we are talking about how AI can help in the healthcare systems, we need to have a much more unified data sets what we have right now. Because if we are just focusing on Europe, emerging Europe, we definitely have issues with that. We have, like GDPR, we have some central regulation which can help us in the further steps, but still we don't have the data pool, the unified data sets between countries, which can be utilized for further innovation and further cooperation in the reaction of emergencies and pandemic handling. So that's something we definitely need to do. And of course, we need to identify what could be the further steps in order to make a little bit more centralized operation. But again, I truly believe that we should find, and we should actually choose the middle way between those kind of two systems what we are living in right now.
And just a short follow-up, I'm going to ask Tomas and then Ivana the same question. But Tomas, just because you've been talking, I'll start with you. If you had to put us on a scale 1 to 10 of where we are with technology and healthcare, if you had to put Asia, I mean, I'm talking about countries like Korea, like Taiwan, which we know have done so well, and then places like the emerging European countries, on a scale of 1 to 10, 10 being the most technology, where would you put Asia? 1 being the least, where would you put us in Europe?
Wow, it's a tricky question. So I believe that Asia is somewhere 8, so 7 and 8, and Europe. So and again, it's a tricky question. Let me give you just a quick footer before I placing Europe on the scale, because availability of technology is somewhere close to the 7 in case of Europe. The utilization of technology, now that's a little bit lower than that. So I would place like 6 or 5, 6. So definitely the preparedness on the technological scale, we have a lower rank in my view compared to Asia, but this is mainly coming from the utilization of these kind of innovations.
I'm surprised that you actually put it at a 6. I was expecting you to say a lower number. Ivana, I want to ask you the same question. You look at all these countries so closely and the technology. Do you agree with Tomas? And if you disagree, no problem at all. Where would you rank our Asian colleagues, and where would you rank us here in Europe?
Yes. Okay, I can start with ranking. Definitely, there is a difference between EU and then emerging Europe. But I would say, and I would maybe put 9 for Asian countries and maybe 7 for emerging Europe. So Serbian government is definitely doing a lot of efforts, and it put as a priority digitalization and implementation of all the emerging technologies. And we truly hope that we will get to Asia to cooperate on the same level. But at the moment, I can say that it's crucial actually to start with events like this, where we can learn from each other, where we can see their experience. As they already mentioned, they had multiple epidemics, and the system is well organized, and we can definitely learn from them, from Asian countries, and then from probably other good experiences all over the world that showed us that during this pandemic. And talking about that, I would like to mention that we will, together with Data Science Conference and Cleveland Clinic, we will organize international conference 24th, 26th of August this year, to actually discuss all the experiences, learnings, and actually talking about health tech towards 2030. So I guess it will be very interesting to hear in more details experiences from all over the world, specifically from US, Asia, and Europe.
Ivana, I want to pick up on a nuance that Tomas mentioned. He talked about technology availability in emerging Europe versus technology implementation. When you hear about all the technology, and again, we have to keep in mind the social norms and differences in terms of privacy expectations. Do you think that even if everybody in emerging Europe were given on a silver platter the technology that Ethan, that our colleague, the professor was talking about, do you think that we would be able to apply them here in Europe? I mean, I'm talking about broader Europe because almost all of us, even here still in the UK after Brexit, we have to go by GDPR. Even if we had every technology available to us for free, do you think that we would implement them here in Europe?
I truly hope so. In Serbia, I believe we're on a good way. In the region of the Western Balkans, I think there is still a long time to go and to get there. And this is why it's important to actually learn and see, set the direction, actually where to go and what are the next steps in order to actually gather the privacy issues, the technological knowledge, the experiences, because it's not just one thing. Technology is there, but implementing them, implementing it actually takes a lot more, especially actually communication with the community, with the patients and citizens. So just putting also regulatory part aside, implementation, it would probably also take a while, and we see that with vaccination. We see that with other technologies that are already there and that could be used, but there is always this kind of gap that we need to work on.
John, do you think there would be social resistance? I mean, there is some resistance to the vaccine in the United States. You see it in many communities of color. You see it in a lot of white Republicans white older male Republicans who are supporters of Donald Trump. They're actually the community that's the most resistant to the vaccine. But when we're talking about resistance to technology, Ivana, do you think that people where you are would have resistance to some of these tools tracking, for instance. We heard Ethan and the professor talking about tracking people's Metro cards, tracking, for instance, their credit card information. Do you think there would be, or has there been resistance where you are to these types of measures from the government?
It depends, I guess. I cannot answer to that yes or no, but I can say that ethics of technology is another important issue. And, by including patients and citizens in all of these discussions, it will probably melt away all the doubts. And it will probably put their input and actually putting the targets and design criteria of what citizens expect. So in which cases they would actually use those technologies and where they would be fine with it. I'm sure there is a way, but I think all the linkages need to sit at one table and make a final decision for implementation of any technology, whether we're talking about vaccines or any other mode of technology.
I want to cross back over to our colleagues in Asia. And Professor, you talked about, for example, the ways that information is centralized, how you're able to track. But in terms of big technology, in terms of AI, in terms of big data, how was that implemented, Professor, where you were during the pandemic in ways that we hadn't seen before? This question is for Ji-Suk Chan.
So I have to say that in our past experiences, we had some shortcomings when it comes to big data and AI. I know that we often talk about using big data and AI in healthcare and medicine, but unfortunately in this COVID pandemic, Korea at the least was not able to leverage our big data and AI technologies. I mean, we did testing of about 8 million people, and there are about 120,000 confirmed cases. So this is a huge amount of data. But if this data had been accumulated properly and in a streamlined manner, then we would be able to do more diagnostics or epidemiological studies of this, do more testing, I think get more sense of the pathway of COVID. But unfortunately, the authorities in charge of disease control does not have enough, they did not have the wherewithal, simply put. They didn't have the time or the mind power to focus on big data and AI in the midst of fighting against this pandemic, unfortunately. In Korea, we have universal healthcare insurance, universal health insurance. So the health insurance authorities have that record of all of the citizens, and we have encryption technology as well. So hopefully, we can try to make use and step up our efforts on big data and AI this time around.
Why do you think that was, Professor? Why do you think that, given your experience, for instance, that you mentioned earlier with MERS, given how advanced that we perceive you in the rest of the world, because you've done so much better than those of us in the West, in Europe, in the United States, why do you think that the central powers didn't have that mind power the way you describe it, that they didn't have the tools or the time to do that? Was it just simply that that methodology is not in place? And will it be in place for the next pandemic?
사실 지금 한국은
In Korea, 10% of healthcare is provided by the public sector, but the remaining 90% is for the private sector. But the data is not unified for the private sector healthcare providers, and that is why there is issue of common data. But in the future, we could make a common data warehouse in order to implement utilizing of big data.
Ethan, I want to jump over to you and your experience. The same question, and picking up where the professor left off. I'm interested, what technology was used this time? We hear about the missed opportunities in Korea in places like Taiwan. What were the successes of using big technology? Was there big success with AI? Was there big success with some of the big data tools that you have at your hands?
I think we were very lucky because at the very beginning when the pandemic happened, at that time we are collaborating with Taiwan CDC malaria automated detection. So at that time, we already have a platform set up in the CDC, and we also have a platform set up in NHI. Therefore, when we respond to the pandemic, we can quickly implement the methodology and work together with CDC and the NHI to put together the solutions. So, for example, not only the chest X-ray system, we also deploy another system that actually every one of 5 confirmed cases, we have virus sequencing of the patient. So because we have the virus sequencing, we can actually trace the transmission of the virus. So this case is infected from which cases. It becomes the open and the clear approach that everyone can trace their cases because we leverage the big data, we leverage the system to add it to the pandemic very early, so we can have a more detailed methodology applied to the data, like genome sequencing, then leverage the genome sequencing to trace the transmission of the virus. And later on, not only the centralized data we leverage, we actually collaborate. We call it Federated Learning Alliance. That is actually a alliance across 80 medical centers in Taiwan, which means not only the centralized database NHI, we have hundreds of billion medical record we have, but also we use a decentralized approach. If you look into like the way we do our machine learning technology, we actually respect the GDPR and we respect the privacy and the integrity, because we leverage the instead of we pull all the data together into a centralized database in NHI, we now actually leverage the same protocol. So the data will stay in original hospital, or the data will stay in their original personal device. But we put the same protocol to do the machine learning training. So in this case, we actually help to make our AI algorithm more robust over the time, because all the hospitals, when they apply this AI algorithm, it actually train the data inside their hospital. The NHI don't need to pull their data out of the hospital, but it actually make the algorithm better and better. But then we aggregate the algorithm together to become the best algorithm across hospitals. So I think we are very lucky because we have this Open AI Research Institute fund in 2017. Then we collaborate with all the medical centers in Taiwan and put together this AI algorithm with the CDC and NHI. And before 2020, and at the time the pandemic happened, then we can certainly leverage our infrastructure to use in this pandemic. Yeah.
Tomas, I know you want to jump in, so I'll let you just jump in to add on to what what Ethan was saying.
Yeah, just one thing I would like to mention here, that actually you use the example of white male Republicans. So I just want to highlight the importance of education. So that's also a factor we need to be really careful with, because we reach the era, again, I'm using the word era, when we have so much innovation, so much technological new solutions that unfortunately sometimes societies, even professionals, cannot deal with. So actually they cannot keep up with these new changes what we have in our innovation culture. Therefore, it's really, really important now to little bit balance between the readiness of the professionals and the society and the available innovations. Because whenever we are talking about emerging Europe or the entire European region, we are also facing with the issue that most of our healthcare innovations are not getting to the market because of the lack of knowledge or lack of competence, but the lack of entrepreneurship and lack of entrepreneurial skills. So we are not bad. So this is why I use, the ranking of 6, 7 in case of Europe or emerging Europe, because all the innovation capabilities are here, but we are not good at the moment in how to drive them to the market and how to think of a global scale.
Tomas, can you give me a tangible example of that, of a technology that should have been available, that was available, but because of the gap you're describing, just didn't make it to the market?
Oh, it happens actually 100,000 times actually per year. So because if you see that, so there is a CIMIT scale. So for instance, the CIMIT methodology is a really good, let's say, overview how this kind of difference is coming from the projects. So usually we are talking about, also if we are just coming out from CIMIT and thinking of technology readiness level, almost in all cases, the technology readiness level of each projects are higher than the readiness of their business competence. Usually, teams are coming from the ideation phase, so new technology innovators are coming with a team of researchers, doctors, but there is no business capability in the team. So this is why, for instance, EIT Health is also working year by year to accelerate hundreds of startups, to give them mostly, of course, not just business competences as knowledge, but mostly this kind of knowledge, teach them how to create actually a business from a research project, because that's sometimes a serious misunderstandings in young innovators, that they think about a research project. But unfortunately, and this is where the governments and EU can come to the picture, because of course they can fund these research projects and early stage projects, because unfortunately most of the cases investors will not do that, because it's not attractive enough at that moment to have an investment. So this is where the government and the EU has a really significant role, but also they got a significant role to educate people how to make business from their projects. So I can actually give you 100, unfortunately, again, up to how we see it, but we can give you hundreds of examples like this.
I must say that Health Club is probably the best example, because in the Western Balkans region, this is actually the case. So we have huge technological background, but really the lack of funding opportunities, and that's even less than EU, and then also the business knowledge. And actually, this is why we created Health Club, to attract funding, to attract the ecosystem that can support development of innovations of this kind.
Ivana, I'm interested, and then I'll bounce back to Tomas after this for the same question. Where do you see, I mean, we're here to talk about the relationship, what countries in emerging Europe can take from Asia, what Asia can take from emerging Europe. Ivana, where do you see the most amount of technology innovation? Of course, I'm sure you see it right in your own backyard, so we'll say that's number one. But then number two, where are the real centers of health technology growth? Not necessarily what governments are adopting them the most, but where do you see the real innovation happening?
I must say there are several places, but I would probably pin out Israel. They're startup nation, so probably it's not only health, but we can see from the results of this pandemic as well that they're really leading this situation at the moment, and it's definitely based on innovations and startups. So definitely Israel, and I would say actually innovations are happening now all over the world, but probably they're not seen as equal in all places. But
and of course, that's one of the reasons that Pfizer chose Israel for their vaccination program, because it's a small country, it has a centralized system, and of course, hold on 1 second. I want to make sure my computer doesn't restart. Okay. That can happen live in these conferences. And of course, the ability to use their startups to make sure that they can track all this. Tomas, of course, I was expecting to hear Israel on the list. What other places, what other regions, where in Asia also do you see the most amount of innovation? You can name a few places.
Yeah, actually, so I totally agree with Israel. So that's why EIT has also an outreach hub in Israel, because we can learn a lot. But from the Asian region perspective, we're also running soft landing programs in Asia. So definitely Korea, Taiwan, of course. We are also having live relationship with China. And in my belief, we can learn a lot from each other. So first of all, of course, best practices. It's kind of standard term, of course, but we should be open for each other, because these, especially in these kind of global challenges like a pandemic, we need to share the best practices with each other. Also, whenever, for instance, Europe is ready to harmonize the data sets, of course, we are talking about anonymized or pseudo-anonymized data. I would believe that we can also share the data sets between the continents, because that can really accelerate the innovation and also the solutions for these kind of big challenges. So I believe that we are on the right track. And again, it's really hard to say something positive about this pandemic, but fortunately, more and more professionals and decision makers are aware how this kind of cooperation is important between the countries and between the continents.
That, of course, is a silver lining. We have just a few minutes left, so I want to cross back over to Asia. And Ethan, really, it's a similar question, though I'm wondering if the answer is different. The technologies that you're implementing, are they mostly Taiwanese technologies? Where are the major sources of innovation that you're adopting there? Where are they coming from?
I think at this moment for the AI innovation is a global innovation. For example, the chess rate classifier, we actually train the very beginning data out of the global open data. Then we innovate we make it better in Taiwan with the centralized database and also the federated database in Taiwan to make it better, and then we put together the classifier in NHI. So I think the innovation right now is not isolated from Taiwan from others. We work together with global. So we learn from the global, and we also make it better in Taiwan. But after we make better with Taiwan, because we are Taiwan AI Lab, we are Open AI Research Institute, we also welcome the global partner work with us and take our solution back to other country and see what will happen and what will apply.
We have just about a minute left, Professor Ji-Suk Chun, so I want to go over to you. Where is the major innovation happening? Of course, we know in Korea. Would you say majority of the innovation comes from Korea? What other places as well are you adopting this technology? Just 1 minute, Professor.
Well, I have to say that I am not an expert on medical innovation. I am a practitioner in the field, but I can say that when I go to Europe on business trips, sometimes I feel that the countries there, the individual countries are very innovative all in their own way, especially in the field of healthcare, but it doesn't seem like they are particularly collaborating very closely. So that was my impression in the past. But because we all know that there is going to be another pandemic down the road again, so if there can be a network of sorts where we can institutionalize cooperation among these different countries, I think that is going to be very helpful in the future, because we continue to degrade all of these ecosystems, and there are like 5 different infectious diseases that come out every year. And so if there are at least a network for hospitals or medical facilities, that could be its own form of innovation.
Professor, thank you very much. And thank you to our other panelists. It's really interesting to see what we can learn from each other, which regions and continents have been able to make strides, and where we can come together. I want to thank each of the panelists for coming from 2 very different far parts of the world, all here. Andrew, I want to go back to you, and I have to say it's really fascinating for me because, you know, at my time at CNN and in the coverage that I do now, what so much of it is talking to businesses. And what I heard here is that the same challenges that any company, I mean, I've interviewed huge mobile network operators, and their big challenges are centralizing data, practices across their smaller companies. And that's the same type of issue that we're hearing here, that's what we need: centralized information, big data banks. So it looks like this is a problem that can be solved between business and government and coming together, which is, of course, what this conference is all about, Andrew.
Yes, we need to be prepared for another pandemic in case it comes in the future. Thank you very much, Sam, for this session, and a huge thank you for participating to all the experts. And it was great listening to all of you. Now, the COVID-19 pandemic has hit fast forward on a number of trends, from e-commerce to workplace and city planning. In the next session, we will speak about how this short-term chaos resulting from the pandemic can bring long-term transformation and help plan and build efficient infrastructure to improve transport links, and what role technology, innovation, and sustainability will play in shaping the future of our cities. The next session will be moderated by Craig Turp, Editor-in-Chief at Emerging Europe. He will be joined by experts from the International Finance Corporation, WWF, and KDHC. Craig, over to you.